This video, we're going to talk about functional knee extension in the terms of how it works with the whole body as a whole. So that includes especially the hip, just the whole leg, really, and even your core. So say you just had surgery or just lacking functional knee extension, a commonly prescribed exercise, so if I'm here, right, if I can't straighten my knee, is to say, okay, push your knee down into the table, right? So say it's tight, stiff, I'm gonna work here, right? And it'll feel, you feel your quadriceps muscles and you're doing the job, right? But the problem is once you get there, if you just train to push back, functionally speaking, right? This isn't what we want. We don't wanna hyperextend the knee. We don't wanna train your leg to hyperextend the knee. That's not how we do it. You wanna think more to stand tall and straighten the leg, you push down to lift up. So we're pushing this way, not necessarily that way. That happens because of the downward force and it's almost like a kinked up piece of wire pulling the kinks out, right? So you wouldn't stand there, sit there doing this all day when you could just do that. That's a lot simpler and easier, right? So that's functionally what we're talking about. So train yourself with your hip, knee, and your whole leg to think about how you would straighten it out if you were standing. So I'm gonna lie down here. So I'm going to think about actually pressing like a leg press. It's almost like a heel slide, right? So I'm even driving from my core here. I'm gonna think about with my pelvis, driving through my heel. Okay, I don't wanna do my toes so much because one, you might give yourself toe cramps. And two, those aren't big, strong muscles anyway. This is more standing where we'd be on our arch of our foot, not on our tiptoes. So we're just driving, pushing through and pressing and even shifting my weight into the table and through. So I'm engaging my glute, I'm pushing down into the table there, relatively speaking, okay? So we're kind of engaging there along the table rather than just down, but we're kind of flattening to the table and driving down there. And imagine your weight coming through, like your body, you're trying to stretching tall, but it's almost like you're reaching through your heel. And what you'll feel, what you should feel is your glutes are gonna fire to squeeze and your quads are gonna fire. And with the quadriceps muscles, you wanna imagine that you're trying to, when they tension, they're actually pulling the kneecap up that way to help lock the knee, okay? And that's important because when you're just doing this, it doesn't necessarily give the feeling that you're pulling up. It's a different direction, it's actually perpendicular. So you wanna think it's an S-plane, like this plane of motion, but it's this up, down in the front and the back, right? So I'm channeling down from my glute through my heel, but at the front, I'm actually pulling the kneecap up this way and I'm leveraging to straighten the knee. Like I'm twisting rope through a pulley, like a chain or something on a pulley, okay? So I wanna get a sense of just straightening the leg that way. Just gently at first and then getting used to that. But when you stand, right? Push down, lift up, like that, see? And so as I shift, I start with a little bend, shift over, engage, connect, engage, and lift. Okay, and that's when you engage on the sides, and inside, outside too, to stabilize, right? Because those two planes kind of intersect, and it's like a cross section, like a plus. So we get the front, the back, and the inside and the outside muscles all working together there. Once you've taken up the slack, they lock in and stabilize, and that generally helps to create a functional terminal knee extension for better balance, better control, and going in and out of that also to be able to more accurately lock and unlock the knee, which is actually a T-plane, so twisting, but it's not something you have to really emphasize. It should happen pretty naturally with those motions, and it can certainly be facilitated with some manual techniques and some gentle, awareness practices and guidance, but it's not something you should really try to twist turn, especially if that's a component of your injury or if you had surgery. Okay?